In the vast majority of cases, when you go to the levels above L5S1, then you will have to widen the interlaminar window, and you need to do so by using the high-speed burr and also by using varying sizes of Kerrison punches. It's very important that you create this space laterally, because if you don't do so, and basically if you force your way into the spinal canal, for example, with dissectors or with any other instruments, then you will run a risk of compromising or even injuring the neurostructures. So you have to be very, very careful with that, and you must use the high-speed burr, which is therefore essential at some stage later on during your learning curve, that you know how to use it and you know how to apply these tips and tricks. The trick here when using the burr is that the working sleeve will stay outside of the interlaminar window and is basically resting on top of the facet joint, whereas the actual burr is a little bit deeper inside the interlaminar window. And this way then you can easily and freely maneuver the burr, you can go up and down and laterally, and you can make sure that you will never need any force. These are always very easy sliding movements. The most common mistake in this respect is that you accidentally slip with your working sleeve just a little bit lower into the interlaminar window along the facet joint, and now you're stuck inside the interlaminar window and you can't move around anymore. So this is when you have to pull back the retractor, the working sleeve, a little bit, and then you can continue working easily with your burr and you can move around. Please also make sure when you are working with these sharp instruments in very close proximity to the neural structures that you basically build in your own safety stop. And you can do so by placing your ring finger, which is placed on the working sleeve whilst holding the burr. And by doing so, you will basically fix the plane in which you are working, and this will prevent that you accidentally slip down in the direction of the nerves or the dura. So if you use the burr, and if you get the feeling that you cannot get there, you want to go cranially or caudally and you cannot get there, again, please don't use any force. Rather, try and rotate the burr and the sleeve. And the trick here is, please remember that the working channel of the endoscope is not located in the middle, it's not located centrally, but it's rather located eccentrically. So if you rotate the burr, and by doing these rotational movements, this should also help you to get anywhere where you need to get in the vast majority of cases. So this is one other trick that you can try if you think you can't get to the cranial aspect of the interlaminar window. This will basically do the job in the majority of cases.